Yeah, at the moment, my daily work is changing continuously because right now I'm in an operating theater that we closed last week and transformed it into a COVID ICU. And this is the second block out of 3 in my hospital. So now we have a general ICU that is clean with no COVID patient. But now we canceled all the elective and non-urgent surgery, and we are using 2 other theaters for COVID patients. So we are expecting a surge in the next days, and we all hope that this surge will not reach the intensity of Lombardy. We are probably 9 to 10 days behind Lombardy, and the intensity that this epidemic reached in the area around Milan was really hit very hard the healthcare system. So many hospitals are nearly collapsing, and the forecast for the next 10 to 15 days is even worse. So this situation changed completely our lives in little more than 1 week. We are working very hard with extraordinary efforts in order to increase our ICU capacity and hospital capacity. With also high dependency units working a lot in order to increase availability for patients. But we are not sure that will be enough. So my suggestion is that you get prepared as soon as you can, because once you start admitting severe ICU patients, it's probably too late for social distancing, isolation, and lockdowns.
Yeah, on that note, Marco, with the measures that have been taken in Italy, almost complete lockdown, like you say, you don't expect that to have a huge effect for you over the next 9 or 10 days?
We all hope that we'll see those effects in a little more than 1 week, probably 10 days, but the next week will not be affected by the lockdown, because this is one of the characteristics of this disease, and especially of the severe cases. So this is an investment for the future, for the second half of March, and it is essential, otherwise we will collapse. But the next few days will not be affected at all by the lockdown implemented a few days ago. So what we know now from the epidemiologists is that a lockdown 24 to 48 hours earlier can have huge consequences 10 to 15 days later.
Marco, tell us a little bit about the people you're seeing coming into ICU there, and what you're seeing. Tell us what you're seeing in front of your own eyes.
Yeah, you know, it's true that for 9 people out of 10, they will experience a sort of mild clinical course like a seasonal flu. But for approximately 1 people out of 10, this will be much more severe, requiring oxygen therapy and antiviral specific therapy and hospitalization. And for a large part of those patients, this severity will reach a need for endotracheal intubation and mechanical ventilation for many days. So we are treating those cases. And this means a long journey in the ICU, a long ICU stays, and many days of ventilation and mechanical ventilation, because the respiratory failure is severe, is reversible, but it takes a lot of resources and a lot of time in order to improve.
We see some of your staff in the background. How are the staff in the hospital there, the San Giovanni Bosco?
We are still opening this block, and we are just admitting now the first patients, and I'm in the clean area. We are really working very hard. We doubled our shifts, and after 10 days, we are already, almost all of us, we are sleep deprived, and that's a problem because we are gonna run a marathon, and we started with a rhythm that we are not sure we'll be able to bear for 1 or 2 months. So, but we cannot do anything else, I mean.
Marco, when you look at, you're obviously and understandably preoccupied with what's happening on the ground in the hospital, in the city, in the region that you are working in. What do you say to other countries around the world?
to other countries. I have a lot of contacts with colleagues. I've been contacted by media outlets and colleagues all over the world in the last 4 or 5 days. And I'm trying to spread the word as fast as we can, get prepared as soon as possible, because the only way to prevent healthcare system collapse is to enforce a lockdown as soon as possible, to increase your ICU capacity and your hospitalization capacity, and to use simulation and to train in using PPEs, personal protective equipment, because it's crucial. Because if a lot of healthcare staff get sick in the first few weeks, then you will not have anybody able to take care of the patients.
Yeah, on that, Marco, have you and your colleagues, the healthcare professionals, are you? I know you said you're sleep deprived. Are you holding up in terms of being infected by this virus yourselves?
Yeah, I have a couple of colleagues who had tested positive last week. So we were tested, and I'm negative now. I have to repeat my test on Tuesday. And I know of colleagues in the red zones in Lombardia where they were overwhelmed by patients that refused to be tested as they were asymptomatic, and they chose to continue to treat infected patients and working with suspect infected colleagues because the workforce is really scarce, and ICU patients need very specialized staff, both clinicians and doctors, and both nurses. Nurses are the real heroes of this epidemic and this emergency.
Yeah. Just finally, Marco, I know you said that you're focusing on trying to expand capacity. You're standing in a room that is now being turned into a ward. Does Italy and your region have that excess capacity to draw on? And how important is it to have those things in place when you're looking at other countries early on?
Yeah. I'm not sure that all regions in Italy will be able to do the same as Lombardy. Lombardy is one of the richest and with the largest leading teaching hospitals, and they are making extraordinary efforts. And also we have the advantage of having them some 10 days ahead of us. So we will take the opportunity to learn from them. We are sharing information very quickly with colleagues. We have daily webinars and networks to share information. We are really making extraordinary efforts because this is an unprecedented situation for all of us. And I hope that other countries, but I cannot predict what will happen in countries with less efficient healthcare systems, and also less abilities to create networks and to collaborate, because we cannot work in a silo. We have to work in a network. Okay, so we have a responsibility for all the patients, not only for the patients that we admit in our specific hospital.
Marco, just finally, when you started on this career journey, I mean, did you ever expect to be in this situation right now? I'm aware you probably have prepared for it very well, but now it's here.
No.
How do you feel?
It's surreal sometimes. And also, I think that the lockdown and the emergency sparked a lot of feelings and solidarity, and strengthened a lot of people and characters. We discovered and we realized that we are more probably resilient than we thought just last month. I'm prepared to treat those patients because those are respiratory failures, and this is my daily job. But for sure, nobody was prepared to treat so many patients at the same time. So this is unprecedented for us.
Yeah, Marco, thank you so much for taking this time to speak to us. We wish you all the very best, and hopefully speak to you again soon.
Thank you. It's been a pleasure. Thank you.